Hey everyone, Jack here. Hope everyone is surviving this self-isolation and quarantine alright. I know we miss being in Dr. Wilbur's class, but alas, here we are. I wanted to talk to you all about a different disease outbreak that happened this year and is still ongoing amid this coronavirus pandemic. Neisseria Meningitidis is occurring in an outbreak in Benin, which is a French-speaking country in Africa. So I wanted just to lay out and go over some of the disease factors and the virulence of this microorganism and discuss factors for your safety. The outbreak of the meningococcal disease is caused by the microorganism Neisseria meningitidis, and this outbreak this year had been reported in the Banakora district in northwest Benin, which is on the border of Burkina Faso. Meningococcal disease discusses the illnesses caused by this bacteria of Neisseria meningitidis, which includes severe and deadly infections. These infections of the lining of the brain and the spinal cord are derived from the word meningitis and can also cause bloodstream infections. The bacteria of Neisseria meningitidis is spread through the respiratory secretions such as saliva. There are a series of severe symptoms and also less severe symptoms involved with the meningococcal meningitis, which is the term that doctors use to call the bacteria Neisseria meningitidis. When someone has the meningococcal meningitis, the bacteria infecting the lining of the brain and the spinal cord cause swelling. Common symptoms of the meningococcal meningitis include fever, headache, and stiff neck, but there are also more severe symptoms that are not as common, including nausea, vomiting, photophobia, which includes being more sensitive to light, and an altered mental status leading to confusion. For the causes of Neisseria meningitidis infection, there are actually about 1 in 10 people who have the bacteria in the back of their nose and throat who are asymptomatic and do not show any signs of illness. This is called being the carrier of Neisseria meningitidis. However, the bacteria will often invade the body and cause certain illnesses, including the meningococcal disease. Of the 6 serogroups, or the types of the Neisseria meningitidis, serogroup C is the culprit of the Neisseria meningitidis strain that is currently involved in the outbreak in Benin. In order to be spread to others from an infected individual, people spread the bacteria by sharing respiratory and throat secretions. Generally, it takes close or lengthy contact to spread these bacteria, which would include coughing or kissing. Fortunately for meningococcal, they are not as contagious as germs that cause the common cold or flu. Therefore, people do not catch the bacteria through casual contact or by breathing air where someone with meningococcal disease has been. In order to diagnose a patient who may believe they are having symptoms of the Neisseria meningitidis bacteria, a spinal tap is necessary in order to get spinal fluid where the presence of the meningococcal disease may be. The best way to reduce the risk of infection of Neisseria meningitidis is to avoid contact with anyone you might think is infected with the meningococcal disease. Further, please don't take any trips to Benin or its neighboring countries anytime soon, as this might become a more serious problem. Further, if you or a loved one has meningococcal disease, you may be suited for prophylaxis, which is antibiotic treatment for those around the infected person so that they may not contract this disease as well. The normal treatment for meningococcal disease includes a series of antibiotics. However, if the infection is determined to be more serious than that, there might be a necessity for breathing support, lowering blood pressure, removal of dead tissue via surgery, and wound care for the parts of the damaged body. Thanks for tuning in for today's video about Neisseria meningitidis. I hope that I provided some information regarding another outbreak here in the world. As always, stay safe, keep your distance from others, and stay quarantined and healthy. See you guys next semester.